Hey, this is Dr. Black at Queen City Animal Hospital. I will be going over the discharge instructions for your dog or cat's spay surgery, and we'll also be sending these in written form via email. So after you review this, please let me know if you have any questions that I can address when we speak on the phone. You will notice that your pet has a shave spot on their arm where an IV catheter was placed, and this is where they received fluids and injectable medications. You will also notice that they have an incision and shaved area on their midline of their abdomen. The sutures from that are buried in the skin, so they will not need to return for the stitches to be removed, but we do need to follow some aftercare instructions very closely to prevent complications. One of these will be preventing them from licking or chewing at the incision using a cone or an e-collar. We will send one home with you today, and I do recommend using that over a inflatable donut collar, which pets can easily get around, or a Sudical, which is more like a onesie. Sometimes the Sudical can be effective, but you do need to closely monitor and make sure that your pet is not able to get around that material or lick or chew through it. The other most important factor with their recovery is keeping your pet calm or rested during recovery. We want to keep that incision clean and dry and avoid excess activity like running, jumping, or playing. So when you take your pet out to go to the bathroom, if it's a dog, you should keep it on a leash. If it's a cat, you should keep it confined to one room of the house where there's less availability for them to run and jump from high surfaces. We will send home a couple of post-op pain medications to keep them comfortable, one of which will be a non-steroidal anti-inflammatory, and you should monitor for GI side effects like vomiting or diarrhea with that. The other will be gabapentin for dogs, which can cause a little bit of sedation or sleepiness. If you have a cat, the second pain medication will be a long-acting transdermal opioid, which is a medication that we apply to the skin and it is absorbed and lasts for the next 3 to 4 days. With that long-acting topical medication, the side effects of altered behavior can be seen with cats, and that is normal. They may seem a little bit more shy or sleepy, or you might not notice significant side effects. The anesthesia side effects that you can monitor for would be most often related to being a little bit groggy for the rest of the day. You are welcome to feed them when you get home. If they are not interested, I am not too concerned for the next 24 hours because the anesthesia can slow down their gut, and so they may not have quite their normal appetite or their normal bowel movements for the next day or so. As I said, their sutures will dissolve, so they do not need to return for a follow-up to have those stitches removed unless you have any concerns. Please let us know if you have any questions, give us a call or send us an email. Thanks.